Next up on the stage is Caryn Husman, UNE faculty in the Health, Wellness, and Occupational Studies Department. Come on up.
One fall Friday, I unexpectedly became a mom. I was working with one of my pediatric occupational therapy clients. We'll call him Cole. Cole was about 4 years old, big blue eyes, funny and sweet, except of course if you placed a demand upon him, in which case he would probably hit, kick, or bite. Cole was also very imaginative, and whenever he came to OT, he would come with a pretend play scenario. Sometimes we were going for ice cream. Other times, he was a dog. But regardless of what he brought, I just played along, introducing activities to work on his fine motor, visual perceptual, and postural skills, thereby getting him to work on things that he ordinarily would have refused through the use of play. This particular Friday, he came in and he said, "Mom, can we play Legos?" So jumping into the game, I said, "Sure, son." And we proceeded to play Legos for the next hour, him calling me mom and me calling him son. But on this particular day, when we left the therapy room, he kept calling me mom. And when we got to the classroom, he kept calling me mom. And when we went out to the library, he kept calling me mom. And all of a sudden, I found myself pretending that I really was his mom. And I kept pretending all weekend long. The next morning, we made little silver dollar pancakes together. And then we went to the park, and I pushed him on the swing, and we looked for bugs under rocks. And later on, we cuddled on the couch with books. And that night, I got him all dressed up in his frog pajamas and tucked him into bed and kissed him on the forehead and said, "Good night, Cole. I love you." And he said, "Love you too, Mommy." Now, of course, I knew this wasn't real, but some little part of me started to think that maybe I really should be Cole's mom. And maybe Cole wanted me to be his mom. And maybe I could do a better job than his own mom, who was a young, single parent with 2 other kids, one of whom had a significant disability. But luckily I knew better. So first thing Monday morning, I went in to talk to one of my colleagues, a psychologist who I often teamed with on our mutual clients. And I told her that Cole had pretended that I was his mom for about an hour. Didn't mention that I'd been thinking about it all weekend. And she looked at me and said, "What a wonderful fantasy for Cole that he would get to play with his mom alone for a whole hour." And that's when it hit me. Cole didn't need me to be his mom. What Cole needed was for me to help his mom be the best mom she could be. Thank you.